I'll turn it over to our presenters and we can get started.
Thanks, Daniel. Good afternoon, everyone. My name is Jennifer Landheis, and I am the Director of the Stalking Prevention Awareness and Resource Center. I'd like to begin our time together by having you all answer the poll that you see up on your screen if you're tuning in by computer today, which just asks you which discipline you represent. And for those of you that voted other, if you have the opportunity to let me know in the chat box which discipline you represent, that would be helpful so that I can frame our conversation today. Right now, it shows that about 90% of us are identifying as advocates, which is not unusual on a coordinated community response webinar, but want to make sure that we include all the other folks who might be on the call as well. So, Daniel, you can go ahead and shut that poll down, and we'll move on to our first slide. Thank you. For those of you who are not familiar with SPARK, SPARK is funded by the Department of Justice Office on Violence Against Women to provide training and technical assistance on all things to do with stalking. So if you have not checked out our website, I highly encourage you to do so. It's stalkingawareness.org, and you will see that I will refer to our website for additional resources several times today. So please make sure you check it out. I think that you will find several things on that website helpful to you. And if you participate in social media, highly encourage you to follow us on Facebook or Twitter or Instagram, and our handle is Follow Us Legally. So we're going to spend some time today talking about the criminal justice system and the coordinated response within the criminal justice system, but also want to acknowledge that absolutely we have lots of victims of stalking who are choosing not to access the coordinated community response through our criminal justice system, because the criminal justice system isn't something that's safe for them, isn't something that they want to access, they perhaps have not had past luck with that particular system. But I also want to acknowledge that there's probably some of you on the line that are also working on coordinated community response teams within a campus jurisdiction as well. So certainly want to call that out and let you all know that our services at SPARK are available to help you in those particular efforts as well. One of the things that we know as far as stalking cases is that it can be pretty challenging for the criminal justice system. And one of the things that comes to mind, first of all, when we look at the challenges, is that oftentimes stalking is viewed only as the surveillance behaviors. And we're going to spend a few minutes talking about all the different behaviors that constitute stalking. But typically, when systems are responding to stalking, we're looking at surveillance behavior, which is problematic because stalking contains more than just surveillance behavior. And what we see oftentimes is that when stalking cases are not focused on surveillance behavior, we are missing them in the system. Either victims are not identifying that the behavior is stalking, or that we as responders are not considering that particular behavior as stalking either. We also know that a lot of these particular cases appear pretty insignificant in the beginning, that there may be instances of the offender following the victim around, there may be vandalism crimes, there may be property invasion, and in the beginning, they don't appear frightening to the victim. They might not catch our eye as stalking cases. And so what happens in lots of communities across the country is that stalking crimes fail to even be looped into a coordinated community response because we don't identify them as stalking cases. Instead, they're looked at as harassment or property cases. And a lot of times we don't understand those particular behaviors that are happening to victims and how scary they are, because stalking is really a contextual crime. Many times the behaviors mean only something to the victim and the respondent, and they seem benign or not important to those of us that are responders. We also know that oftentimes when victims are experiencing these particular behaviors, the individual acts in and of themselves may not be criminal. For example, it's not criminal to send someone a text message. It's not criminal to show up at a baseball game. It's not criminal to come into somebody's place of employment, unless, of course, we are looking at those behaviors within the context of a stalking crime. So what often happens is when those behaviors occur, victims know that a crime has not been committed. They may contact law enforcement or a victim advocate who explains that there wasn't a crime that was committed. And victims get frustrated because they're scared, they view it in a larger picture, whether or not they share that information with all of us. And so oftentimes they've had poor interactions with those of us in the criminal justice system, or they feel like people don't understand exactly what's happening to them. And after that initial reaction, they fail to access the system again after that. What we also know is that when we look at stalking within the context of intimate partner violence, we overlook it frequently, and we don't respond in the way that we could or identify the potential lethality risks that those pose in domestic violence cases. And then last but not least, we know that many of these responses are multi-jurisdictional, that we might have one incident that occurs at the victim's home and another at the victim's place of work and another where the victim goes to classes, and those are 3 different criminal jurisdictions. And frequently, victims don't understand jurisdictions. We as responders fail to think about what our response looks like across jurisdictions. And so one of the things that I would encourage you to think about today when we're talking about a coordinated community response, we're talking about the larger community, not just what's in your criminal jurisdiction, but what is happening in your larger community. Because we know that offenders don't just stop at county boundaries, and that we really have to look at what's our larger response, not only across jurisdictions, but across systems as well. And understanding that if lots of victims don't access the criminal justice system, what does our response look like outside of that criminal justice system? What does our advocacy response look like? What does our educational system response look like? All of those things in order to build a better response in its entirety for victims. The definition that we'll be using today for stalking will seem familiar to a lot of you if you've been on a presentation by Spark before, but it also may be familiar to you if you are working within your criminal justice system because it's usually mirrored within your state statutes. And we use that definition that it's a pattern of behavior directed at a specific person that would cause a reasonable person to feel fear. And what we know about the prevalence of stalking is that it affects approximately 1 in 6 women and 1 in 17 men during their lifetime. And we know that that prevalence rate is a little bit low compared to what it probably actually is, depending on the questions that are asked victims. But if our prevalence rates are approximately 1 in 6 and 1 in 17, why is it then that we are not seeing this number of victims or perpetrators or stalking cases through our criminal justice system? If the prevalence rates are that high, why are victims not accessing the system? And I would love some thoughts from all of you if you want to chat in the chat box with me as I'm asking these questions. It's always nice to know what you all are seeing as far as barriers. And obviously we see lots of individual barriers for victims, and that's going to be the same and very similar to what we see for domestic violence and sexual assault crimes. But we see some unique institutional barriers when it comes to stalking crimes as well. I see Jackie mentioned shame, absolutely, especially if you might be working in a smaller community. Shame is one of the things that many victims articulate as one of the reasons that they don't come forward, or maintaining that they don't have any proof in these particular cases, or that people are not taking them seriously. Excellent answers. You all have definitely have the same themes coming across the chat there. The things that I would like to mention as far as institutional barriers is really the number one thing that we see within the criminal justice system is lack of report taking or incident documentation. What we see happen oftentimes is that victims have accessed the system a couple of times and there's no reports that are taken, or the reports that were taken were, if they were given to, say, for instance, law enforcement or, say, a campus response individual, are often classified as things like property crimes or harassment, and they're not looked at as stalking cases. What we know is that if we ask the victims of stalking, are you being stalked, a majority of them will say no. If we describe the behaviors that constitute stalking, and we say things like, is someone showing up unexpectedly? Is somebody keeping you from leaving certain places? Is someone forcing confrontation? Is there somebody committing property damage? Then victims say, oh yes, absolutely, all of those things are happening to me. But they don't identify that they're a victim of stalking. And so if we have victims that are not identifying, oftentimes we have responders that are not identifying as well. And so one of the challenges that we have in these particular cases are, how are we documenting things? How are we understanding what constitutes stalking in the first place? What do our procedures look like across agencies? I would be willing to bet that no matter where you work whether it's in an advocacy agency or a law enforcement, most of you have policies and procedures when it comes to responding to victims of domestic violence and sexual assault. Do you have policies for responding to victims of stalking? And most people say, well, I mean, sort of. Are those policies for all victims of stalking or just intimate partner victims of stalking? If law enforcement in your jurisdiction, say for instance, goes out on the scene of a stalking crime, do they have a packet of information that they give to all stalking victims like they do to all victims of domestic violence? Probably not, because in the case of domestic violence, it's usually mandated by state statute that they give out information, but it's probably not for stalking behaviors. And so what we see oftentimes is that stalking victims who access the system don't have that systemic response across individuals within organizations. They kind of luck into a good response if they happen to get a responder who's trained and understands the dynamics of stalking. So one of the things that you need to be thinking about is how are you internally looking at your own policies and procedures when it comes to working with stalking victims. There's also a huge lack of cross-training across agencies when it comes to stalking. How many of you have attended stalking training before? How many of you receive stalking training on a regular basis? How many of you are providing stalking training to other individuals within your coordinated community response team? So things to think about as we go along, as well as understanding that many times people do not see stalking as a lethality factor that it often is in these particular cases. So as we look at our coordinated response across the country, these institutional barriers oftentimes create problems for victims and are things that we have not addressed internally within our agencies and organizations. I see a couple of you saying that you've had trainings but not on a regular basis, especially within your CCR. Others are saying, I don't even know if the folks that we are working with get access to DV packets. So things to think about as we're building our response. And please know, as we talk about all of these things, there is not a single jurisdiction across the country who would probably say that they're hitting the ball out of the park when it comes to stalking response. What we know is that our response to stalking is often years behind our response to domestic violence and sexual assault. So these are all things to just think about, not to shame you into do you or do you not have these, but things to consider as you're building that particular coordinated response. So as I mentioned earlier, one of the things that we encountered is the lack of understanding about what actually is stalking. And the best framework that I've ever seen to be able to explain what stalking actually is was put together by Dr. T.K. Logan of the University of Kentucky. And she actually refers to this framework as the SLI framework, and it stands for surveillance, life invasion, interference, and intimidation. And so what we know happens is oftentimes when victims are experiencing surveillance behavior, what most people would think of as the stereotypical stalking behavior, things like following and waiting, showing up, perhaps monitoring a victim's social media, or proxy stalking, which is just a fancy word for using a third party to engage in stalking. When those particular behaviors happen, those are more likely to spark something in a victim that says, yes, I am being stalked, or to spark in a responder, yes, this is a stalking case. However, surveillance only makes up one of the four categories of behaviors that we see happen in stalking crimes. What we also see are things like life invasion. So an offender making unwanted contact at a victim's home or showing up unexpectedly. If you're working in a rural jurisdiction, this is particularly problematic if you only have one grocery store or one gas station, because offenders try to excuse away their behavior by saying, oh, well, if there's only one grocery store, of course I'm going to show up there. It can also be things like property invasion or public humiliation. And oftentimes when this particular behavior is happening, the life invasion behaviors, victims are upset, they're frustrated, they're angry that the offender keeps getting away with this. They might feel humiliated and shamed about what's going on. Several of you mentioned that as a barrier to reporting. But when they report something that fits in the life invasion category, oftentimes they feel like they're kind of blown off by the responders. Like, this is no big deal. I mean, I understand that it's humiliating, but that it's not really a crime. What am I supposed to do about it? Even those of us that are advocates who have victims come in, are like, not really sure what we can do in these particular situations. And what we know is that oftentimes if there's this type of behavior happening, there's a lot of other behaviors within the SPLY framework that are happening, but we fail to ask victims about all the behaviors that they're experiencing. And we fail to communicate all those behaviors to law enforcement and to prosecutors who might be able to use those behaviors in establishing their course of conduct to prove a stalking crime. We also see things like interference, and this particular category is actually interference through sabotage or attack. So it's things like work sabotage, so perhaps showing up at the victim's place of employment and causing issues or just being around a lot, and then the employer says to the victim, you know, that person needs to leave, I'm not comfortable with them being around. And oftentimes there's no employment protection for victims of stalking, and so victims are afraid to tell their employers what might be happening or that this person is stalking them. And if they do, they're worried that they'll lose their job. And so offenders are very good at interfering with victims, not only at work, but in custody if they share children, keeping victims from leaving certain places, so forcing a confrontation, say for instance outside the victim's gym or outside a public place, so that the victim's like, please don't cause a scene, I'll get in, I'll talk to you, we can try to work this out, because they're trying to manage the offender's behavior. And last but not least, we see intimidation, which most of you are pretty familiar with within the context of domestic violence, but things like threatening the victim or threatening to harm themselves or threatening to harm other people that are close to the victim. And so what we know is that many of these behaviors are happening within each category, but as a system, when we're responding to stalking crimes, we have a tendency to really only focus on the surveillance piece of things. And oftentimes what we find is when we're working with stalking victims and we ask them, well, why didn't you volunteer this particular piece of information on your civil protection order? Or why didn't you tell the judge this? Or why did you not share this particular thing with law enforcement? And victims respond, because they didn't ask. So if we're failing to ask about those behaviors, we're failing to see the bigger picture when it comes to stalking. So one of the things that you need to keep in mind, no matter what your role is understanding all the behaviors that happen in stalking cases, because we can't form a response to stalking if we don't consider all of the different behaviors that victims are experiencing. The other thing that we see is that within the context of domestic violence, we miss stalking crimes all the time. For instance, here's a couple of studies that show you for law enforcement, when they're responding to domestic violence calls, they often miss stalking within the context of domestic violence. Basically, what these studies say is law enforcement might be responding to all these domestic violence crimes. They might have enough information within their report to be able to charge stalking as part of the domestic violence, but very rarely, about 1 in 15% of cases, one case within the 15% that constitute that, actually end up resulting in a charge. Another study found that when law enforcement is responding to stalking calls, very rarely are they resulting in incident reports or arrests. And in fact, arrests for stalking crimes often come from calls that aren't reported as stalking. So what we see over and over is that within the context of domestic violence, we fail to identify the stalking behaviors. And I think the best example of that is looking at this power and control wheel. So all of you are probably familiar with this wheel. And what we have done is that when stalking occurs within the context of intimate partner violence, we have become very skilled at explaining the coercive control that happens as part of domestic violence crimes. So we say things like if the offender is following the victim around, if they're accessing their social media, if they're spoofing their calls and showing up as unknown, if they're showing up at the victim's work, if they're monitoring the victim's text messages. We use words like that person's really coercive, they're really controlling, they're intimidating the victim, they're isolating the victim, but we don't identify those particular behaviors, all of which fit in that SPLY framework that I just gave you. We don't identify them as stalking. We simply say they're part of the power and control in intimate partner violence cases, which is fine. And some of you might be saying, well, what does it matter what we call it? what we know is that when stalking occurs within the context of domestic violence, it's a lethality factor. There's several studies that show that stalking is one of the prominent lethality factors in intimate partner homicide. This particular study shows you that there's a threefold increase in the risk of intimate partner homicide if there's stalking occurring. And I would even say, if you look at this particular chart, things like behavior number 5 and 6, the controlling behaviors and the threatening to harm the victim, might also be stalking behaviors. It wouldn't be necessarily just number 8. So if we aren't identifying stalking within the context of domestic violence, how can we identify which cases are most at risk of the victim losing their life or being harmed? And how do we safety plan adequately for those victims of domestic violence if we don't understand stalking as part of the behavior? Another study showed us that within intimate partner femicides, 76% of them were preceded by an episode of stalking, and 85% of attempted femicides were preceded by an episode of stalking. So many of us are looking at a coordinated response to domestic violence or looking at lethality within our domestic violence cases and failing to understand the role that stalking plays within those particular crimes. So I'm going to have Daniel bring up our second particular poll that says that I just want to know, if you have a coordinated community response team, does your team systematically and thoughtfully include stalking? So the first one is we don't have a CCR. The second one is we have a CCR, but it doesn't include stalking. The third option is our CCR only addresses intimate partner stalking. And our fourth one, I have a typo in there, is our CCR addresses intimate partner and non-intimate partner stalking. And I'm going to give you all a chance to answer that because I'm super curious. Okay. Daniel, you can go ahead and close those. So it looks like many of you on the call are saying we don't even have a CCR. So not to fear, the tips and things that we're going to talk about today are if you have a formal CCR response, but also what you can do in an informal basis as well. Some of you are saying we only address intimate partner stalking, which is not unusual. I'm surprised by how many of you say that you're addressing non-intimate partner stalking as well. But let's also go back to understanding what constitutes stalking behavior and how those cases are being flagged. So a couple of examples I would give you are things, for instance, how do those cases get to your CCR? Is it because somebody has made a formal report to law enforcement? Is it because they've accessed victim services? If you had a victim who reported, say for instance, that their tires got slashed, and a responding patrol officer goes out and takes a report. The victim says, the offender did it, the offender's my ex-boyfriend, they've been stalking me, I know that that's the person who slashed my tires. But the victim has no evidence, and police have no evidence that it's happened. What we actually know from some of our newer research is that sometimes law enforcement isn't even going to talk to the offender in those particular cases. They simply take a report, not a stalking report, a property damage report, a vandalism report, and things move on. So if that occurs, would those particular cases get to your CCR response? If you had a victim of stalking who called a domestic violence hotline at 2 o'clock in the morning and said, I needed a safe place to stay because my neighbor's harassing me, would the victim advocate or volunteer who answers that hotline identify that person as a victim of stalking? Would your shelter services even be available to that victim? Or would they say, I'm sorry, our shelter is reserved for victims of intimate partner violence or domestic violence. I can give you the number to the homeless shelter. And victims get screened out that way. So think about your coordinated community response and how you're even screening cases to be part of that if you are indeed saying that you are addressing both intimate and non-intimate partner stalking cases. So just things to think about, and I'd love for all of you to share as you're looking at, and as I'm talking about these particular cases and what your experience is like in your own community. I also want to take a little bit of time to talk about this particular model that's called the Victim Empowerment safety, and perpetrator accountability through collaboration. There's no test on that afterwards because that's a really long name. I've heard it referred to as BestPack. Are any of you familiar with this particular model? If you are, go ahead and chat it in the chat feature. What this particular model does is understand that not every community has the ability or the opportunity to have a formal coordinated community response. And instead, what it essentially did was take a look at the OVW programming and figure out how do we, as a community, set up safety and accountability in our communities. And so essentially, when we look at this particular model, and we're trying to understand what all does it entail, what it entails many times is that we are looking at how coordinated community response systems and teams work across both victim safety and offender accountability. And how do we, as organizations, fit within that model? And how do we leverage the strengths of our partner organizations to be able to improve the safety and accountability measures that we have for all victims? So this one is not particular to stalking, but I want to really play it out for you when it comes to stalking so that you can begin to look at what your community is doing as a whole. So this is the particular model that they came up with. So it starts with assessing community readiness and then looking at immediate safety for victims. What are some of the services that we provide that meet victims' needs, as well as the short-term and long-term well-being for victims. And then on the other side, looking at our justice response. So what does accountability look like in our community? What is restitution and retribution? How do we reduce recidivism? And how do we look at the long-term well-being of our offenders? So I want to play this out for you a little bit when it comes to stalking and looking at some of the things that you have in your community and assessing how does that come across. And I see a couple of you saying that the model's not showing on your screen. Anybody else having difficulty with the model showing up? It is on your PowerPoint. Okay, some of you are saying you can see it. Adobe can be fun sometimes. Sometimes you can see things, sometimes you can't. What I would tell you is on the bottom right-hand side where it says materials and it has the download, you have a copy of the PowerPoint right there for you so you can refer to it again. So look at that particular one, and I'm going to break it down for you. So if you can't see the model itself, I'm going to break down some of the pieces for you. So thank you for letting me know that. So let's look at the community readiness piece of things first of all. How familiar is your community with what stalking actually is? Would they know what constitutes stalking? Would they know where to go for services if they were a victim of stalking? Do they have a general understanding of what stalking is? Many communities are well versed in creating awareness on the issues of domestic violence and sexual assault. They're participating in Domestic Violence Awareness Month and Sexual Assault Awareness Month, less so in Stalking Awareness Month. And so what are you doing to build community awareness in your community? And if you are somebody who's responsible for that, don't reinvent the wheel. Simply go to Spark's website, and we actually have public awareness training modules available. So my colleague Dana, who's on the call today, just did a fabulous webinar a couple of weeks ago on that particular training. It has the PowerPoints, it has videos that you can use, all the things that you would need to create awareness within your community about the issue of stalking. So if you're not sure where to start with the low-hanging fruit. It's an easy way to be able to access it, and thank you, Dana, for putting the link right in the chat session. So you can get on and access the public awareness training module. It has everything that you could possibly need. If you need any help, please let me know. The other thing that you can think about is what kind of ongoing training are available for professionals in your community. Several of you mentioned, get stalking training regularly. So we have trainings available archived on our website, so they're recorded webinars. And then, of course, Spark provides free training to anybody who is an OVW grantee or potential grantee. So if you want assistance in training your community professionals, so your coordinated response team or others within your organization, please access our website. You can ask for trainings on the website. You can look at some of the professional trainings that we have available on there. And then think about what's the infrastructure look like as far as materials in your community. One of the things that we often see is that when we're working with organizations, whether it's law enforcement or prosecutors or others, that they have an abundance of materials, brochures, et cetera, on domestic violence and sexual assault, but very few on stalking. So if that's one of the things that you can do to increase your community awareness, check out our website. We've got lots of brochures, we have documentation logs. We can help you with developing policies and procedures within your organization to really start building your readiness to be able to work with stalking victims. And oftentimes what I see, and I've been working with coordinated community response teams for over 20 years, responsible for implementing several, responsible for being the person that can help coordinated community response teams kind of regroup after they've fallen apart. And one of the things that I see oftentimes is people are really focused on their interagency ability, so their interagency trainings, how they work together, which is extremely important, but they're so busy at looking at how they work with everybody else that they fail to look at their internal policies. And so when I say to them, are you sure that no matter who in your agency responds to this particular stalking crime, that they're going to get the same level of services, the same level of response, no matter who responds? And many times people say, well, you know, in law enforcement, or, you know, they just happen to get a good officer, or they just happen to get a really good prosecutor. And we fail sometimes to look at our own agencies and what could happen if we have a victim of stalking accessing our services. Would our volunteers be able to provide the same level of empowerment and help to victims of stalking that they do to domestic violence? And is it just one person in the office who happens to have more stalking training than others? So really making sure that your infrastructure is really good. How are you training within your organization on stalking so that everybody is providing the same level of response? We don't want victims to just luck into a good response. We want to make sure that it's organized and that no matter where they access the system, they're getting a great level of response. So keep that in mind. So let's go up the victim services side of the model. So we look at immediate safety. So what kind of resources are available immediately for victims of stalking, both not only as victim services, but as first responders as well? So do we have EMTs or emergency medical professionals that are trained in stalking? Would they know how to identify a stalking crime? If we have hotline volunteers that answer a hotline, how much training do they get on stalking? And what kind of services are they available to be able to offer? As well as understanding, when we look at victim-specific resources, how would victims know where to access assistance? It is surprising to me how many communities we go into to give training, and I'll ask them, well, who serves victims with stalking in your area? And many of them will say, well, I assume it's the Victim Services Organization, or others will say, well, I think that organization only works with family members or intimate partner victims of stalking. I don't know if they would help a stranger victim of stalking. So don't assume that your partners know what kind of services are available if you're part of a victim service agency. Don't assume as advocates that others that you are working with have that same level of training and understanding as well. So you might have go-to people within certain organizations that you hope to work with or that you routinely lean on in these particular crimes. Assessing their level of ability to help stalking victims is really important. What kind of civil legal assistance is available to victims of stalking? If you have civil protection orders in your jurisdiction that are available to non-intimate partner victims of stalking, does anybody help victims with that? What I often see is I'll go into a jurisdiction and they say, oh, we have a court advocate available for civil protection orders, but they're only available for the domestic civil protection orders. They don't help with what they deem to be the quote-unquote stranger civil protection orders, which oftentimes will include stalking crimes. What kind of housing is available to victims of stalking? Is there transitional housing or low-income housing available in your jurisdiction that prioritizes victims of domestic violence or sexual assault? Did they also prioritize victims of stalking? Or what kind of transportation or health benefits are available? We've done a really great job of coordinating with our friends within the healthcare community, both physical health as well as mental health. And what I see is oftentimes those individuals will have received training on domestic violence and sexual assault, But stalking is an addendum to that training, and they don't have particular training on stalking. And that's not just within the health and mental health field, that's within all fields. As well as looking at some of the short-term and long-term well-being for victims. So what kind of advocacy do we have available? Do we have support groups for victims of stalking, or do we expect them to come to our domestic violence support groups? Do we have counseling available to victims of stalking? Again, many times we have mental health professionals who are very skilled at working with victims of domestic violence or sexual assault, but may not have had such opportunity to work with victims of stalking. So doing an assessment of your community and figuring out, when we look at these particular pieces, what do we have? What don't we have? And how do we build what we don't have? What are some of the resources that we can be thinking about? Understanding that many of you are working in very small communities that might not even have a mental health counselor available. So where do people go for support? Do they go to their local religious organization? Do they access services through the school system? And what kind of services and availability do we have for victims of stalking within those particular systems? So thinking about that as well. Any questions so far on the community readiness and the victim services before we move on to the perpetrator side? I'm not seeing any pop up in the chat. Y'all are a quiet group. So when we look at the perpetrator side of things, we have to also be thinking about within the justice responses for them, what does that look like? And how are we trying to build a response that looks at the accountability for those offenders? So are we doing our investigations? Are we making arrests in stalking crimes? Are we prosecuting those particular crimes? And what does the restitution and retribution look like in stalking crimes? Oftentimes we have a system built to be able to look at victim impact, so through victim impact statements or others in domestic violence crimes or sexual assault crimes, but we might not have that same ability when it comes to looking at the restitution and retribution in stalking crimes. And how do we make sure that we are entering things like no contact orders or civil protection orders when we're looking at reducing recidivism? And what are the long-term well-being look like for offenders of stalking? We get asked all the time, how do you treat an offender of stalking? And unfortunately, the research isn't really great in addressing that. People don't have a really great modality for working with offenders of stalking. Obviously, many of the things that you have in place for victims of, or for offenders in domestic violence cases could be options in intimate partner stalking cases, but also looking at what availability do we have to be able to hold offenders accountable in these particular situations. So any questions on this particular model before we move on? This can be particularly helpful if you do not have a formal CCR. You do not have to have a formal CCR to be able to look at some of these particular things within your community. There's lots of opportunities to be able to build your coordinated response without a formal CCR if you look at your community readiness and your victim safety pieces of things. So don't be frustrated by the fact that you might not have a formal CCR, but look for the opportunities within this particular model. This particular model does focus on the CCR team, however. And so I want to spend a couple of minutes when we look at the CCR team looking at all of the players that we have available. So for those of you that have CCRs in your community, you can see up on the screen a couple of different key players when it comes to a CCR. And I intentionally left one puzzle piece blank, knowing that every community has their own resources and availability. So what else do you have that fits in that blank piece of the puzzle there? And I see somebody saying it could be court-ordered alcohol or drug treatment or mental health counseling. Other ideas for other people who might play part of your coordinated community response that might be unique to your particular community? School systems, absolutely. So some of those will lump up into education. Some of them might be a little bit more ad hoc if you have particular counselors within a school or something like that. Other pieces that you all can think of that play into part of your coordinated community response? Faith leaders, yep, absolutely. Yeah, lots of you saying religious institutions. So for those of you, especially in communities where religion plays a significant role, absolutely, those religious institutions might be part of your coordinated community response. Community business boards, absolutely. One of the opportunities I had one time was to go into a smaller community that had really worked on their coordinated community response, and they had invited community business leaders to be part of our discussions. And the coordinated community response was robust, it was strong, it was doing a really great job within their community, and there was one business leader who knew about it out of the like 20 in attendance. So also thinking about how do we spread the word about the response systems that we're building for victims of stalking amongst those who aren't just in our field, right? So what does it look like for folks from like the Department of Health and Human Services or mental health providers and our business communities, et cetera. So great job, everyone. I want to break down kind of the big four when it comes to those coordinated community responses in looking first at law enforcement. So if you look at your law enforcement response to stalking, did they have a stalking policy in place? Many jurisdictions have a domestic violence response, a sexual assault response, in effort to, as I said earlier, make sure that everybody within the organization has the same level of response, has the same level and access to training. So they oftentimes have a policy for their officers on how they're supposed to handle these particular crimes. Do they have one for stalking? And does it address both intimate partner stalking and non-intimate partner stalking? My experience has been, especially in larger jurisdictions, crimes kind of get lumped into either crimes against people or property crimes. And so if a stalking crime comes in as a property crime, say for instance those slashed tires and vandalized houses, would that even reach the person who might have additional training and understanding on stalking crimes? Or would it simply be screened out and be lumped in with property crimes? So is somebody reviewing the cases that come in? A couple of jurisdictions that we are working with right now that are law enforcement agencies have somebody that reviews the reports to look for stalking crimes that might have been missed. And what they have found is they have seen an almost 80% increase in the number of stalking crimes because somebody's now reviewing those reports and flagging them as stalking, and they were being missed prior to that. Is there a specialized caseload for stalking crimes? Who looks at those? What kind of training do they have? And does it mirror their collaborative response in their domestic violence and sexual assault cases? So oftentimes people say, well, we have a really great crimes against persons unit. They're really well versed in domestic violence and sexual assault. Are they also well versed in stalking crimes? Because unfortunately, stalking crimes are long, resource-intensive investigations, and they take a lot of time. They're not a, I'm going to do a really short investigation and we're going to move on type of a thing. So what do the resources look like within law enforcement to be able to respond to stalking crimes and be able to provide the support and resources? If they get a stalking victim who comes in, do they call out an advocate like they do in domestic violence and sexual assault crimes? Do they work with their advocacy agency? I hope so. Some of them might not, though. If you have a victim of stalking who is available for a civil protection order, can they come in and be able to access that civil protection order? Does anybody else help them in those particular cases? So thinking about how do you build that particular response within your law enforcement organizations. Who are your champions there that can help you build that response? And what kind of response do they have? Are they looking at the resources that they have right now? Are they able to preserve evidence? Do they know what those efforts look like down the road? If there isn't enough to charge a stalking crime, are they thinking about charging other things? One of the things that we often emphasize when we work with law enforcement officers is not only building their case, but how do they build the case for the next officer who gets this report? Because they might not have something right now that constitutes a stalking crime, but could there be a trespass warning? Could there be a warning call to the offender? Something that's put in place and documented so that the next time something happens, we can easier prove our course of conduct in these particular cases. And what about our prosecutors? What does that look like? Do we have prosecutors who are willing to charge stalking as part of or in addendum to intimate partner violence or domestic violence cases? What can they charge now that addresses the behavior? So are they able to enter a harassment charge or a menacing by phone charge or a property crime charge that if it gets on the record can help them prove a stalking case down the road? And helping our prosecutors look at these particular stalking cases and work with victims to figure out how do you plan for the long haul in these particular cases, because they do take a while to get prosecuted. And they can be difficult to prosecute, but not insurmountable. One of the things that we would say would be a great strategy would be to use things like risk assessment, to consider firearms prohibitions that they often do in domestic violence cases, or try to oppose the defense motion for victims' private information. Do they use expert witnesses in these cases? We have communities across the country who are getting pretty well versed at using expert witness testimony in domestic violence cases. They can do the same thing in stalking cases. Or are they looking at intimidation of a witness or other particular charges that might be available to them as prosecutors in stalking cases? And one of the things that I would recommend is for prosecutors to check out our guide to stalking on our website. So this particular guide is written for prosecutors who are prosecuting stalking crimes and all the things that they might want to consider in these particular crimes. SPARK is a project of Equitas, and Equitas has amazing former prosecutors who do nothing but help other prosecutors work on holding those offenders accountable. So they are fabulous resources, both for prosecutors and non-prosecutors, but they have the time and availability to pull case law and help prosecutors figure out how do we hold offenders of stalking accountable. So please check out that resource on our website for prosecutors, as well as what happens if we do have offenders that are prosecuted either with harassment or stalking charges. How are we holding them accountable within our probation department? Are we screening offenders to find stalking within our intimate partner violence cases? Are we making contacts with victims or having field contacts or specialized caseloads that involve stalking crimes? Again, we have a resource on our website that's a guide for corrections and parole officers. We co-wrote it with the American Probation and Parole Association, and it's a great resource for individuals who are looking at how do we work with corrections officers in holding offenders accountable in these particular cases in order to improve our coordinated response. And then for those of you that are medical professionals, are you doing any screening for stalking behaviors? Oftentimes you're screening for domestic violence and sexual assault. What would it look like to screen for stalking behaviors? Would it be simply asking questions from those fly behaviors? Are you asking, is somebody following you? Is somebody showing up unwanted? And understanding that sometimes the impact of stalking results in physical and emotional stress. So you have victims who have headaches and stomach aches, or who aren't sleeping, or who are having health issues as a result and impact from the stalking. And are those mental health or physical health providers skilled in working with stalking victims? So if you're from one of those organizations, you're thinking, well, how could we implement some screening questions in the work that we do? Reach out to us at Spark. That's what we are here for. We'll help you figure out what those questions might look like and how do you improve your particular response within the medical community. And then last but not least, what does it look like for our advocacy community? Many of you identified that you were from advocacy organizations. Do you have specific training on stalking? Do you offer support groups for victims? What does safety planning look like for victims of stalking versus victims of intimate partner violence? Do you help victims of stalking fill out civil protection orders or access hearings or accompany them to court, just like you do with domestic violence victims? Do you know how to help victims of stalking document what they're experiencing? One of the things that we would encourage you to look at if you're either a mental health organization or any type of victim services agency is to look at our stalking response checklist. We have a checklist for nonprofit organizations, mostly domestic violence and sexual assault organizations, to be able to access on our website that they could look at their overall response. Do you name stalking on your website? Do you have resources specific to victims of stalking? Do you offer counseling, etc.? So think about all of those things. And shout out to Dana, who's linking all of these resources here. This is why we always have two of us on webinars. I appreciate that, Dana. This is an excellent resource for all of you to be able to use to look at what kind of information you put out. If your organization, say for instance, is called Family Crisis Center, would a non-intimate partner victim of stalking know that they could access services from you? So just a way to kind of look at our particular responses and figure out how do we market that to victims of stalking so they know where to get help. There's a guide for advocates on our website about responding to stalking, so you can check that out as well, and some safety planning strategies. So if you just go to our website, every discipline is listed out there. So it says for victim services providers, and then all the resources are there. Then it says for law enforcement, the resources are there. We're working on a guide for law enforcement officers as well, so that should be up within the next month or two, so keep an eye out for that. So then when you look at those particular internal responses, I said a lot of our coordinated community response is looking at our internal procedures and collaboration and how do we work within our own organization to make sure that every victim of stalking is receiving a great response. But then now how do we collaborate with our CCR strategies? So one of the things that I would encourage you to think about is if you have a CCR that is working on stalking crimes, are you focused on risk? Do you even know what risk assessment looks like in stalking cases? Many times people are using domestic violence risk assessment, so something like the LAP or the danger assessment by Jacqueline Campbell, one of those other domestic violence specific assessments to assess risk in stalking cases. And that's not exactly the best practice because those are domestic violence assessments. They're not stalking assessments. So we would encourage you to focus on a stalking specific assessment. And if you're not familiar with that assessment, it's called SHARP. It stands for the Stalking Harassment Assessment and Risk Profile. It's available on our website. So you can just look on our website and it'll take you to the assessment. Are you processing cases based on risk? Are you looking at the 14 risk factors in stalking cases and developing your coordinated response based on those particular risks? I would guess many of you probably are a little bit because you instinctively know what those are, but a lot of the research on risk assessment with stalking has come out within the last 5 years, and so really being able to focus on that as part of your response is really important. Are you doing case reviews? If you normally do case reviews as part of your coordinated response, are you making sure that you're including stalking cases? Are you ensuring that your responses are not only comprehensive but integrated as well? Do you know what will happen when victims access other parts of the system? Do you know what will happen when they make a stalking report? Do you know what prosecution looks like for stalking crimes? Do you know how your stalking offenders are being supervised in corrections and parole and probation situations? And are you helping victims safety plan in those particular cases? So what we oftentimes see happen is we may have really skilled individuals who are skilled at safety planning with victims of domestic violence, but we don't necessarily think about what happens in stalking cases. And so one of the things that we see happen is that oftentimes people focus their coordinated community response on the behavior that's happening right now. So for instance, if the offender is calling the victim and sending a lot of text messages, we're safety planning and developing our coordinated community response based on the fact that the victim's getting phone calls and text messages. And so someone might even suggest to a victim, well, you know what, change your phone number, which doesn't stop the stalking, and in fact, oftentimes will actually escalate the behavior. And then when the offender cannot get a hold of the victim by phone any longer, the offender shows up at the victim's place of employment. Well, we have safety planned and coordinated our response based on the fact that the offender is contacting the victim by phone, and when the offender switches to showing up in person, we have failed to safety plan and coordinate around that particular behavior. And what we know in stalking crimes is that offenders change their behaviors all the time. So we have to look at what's happening now and what might be happening next when we're looking at our coordinated response in these particular cases. It's extremely important to consider all of those different strategies. We also need to consider in our CCR response, what does our intra-disciplinary training look like and what does our interdisciplinary training look like? You can request trainings on the SPARC website. We are doing those virtually for now. When normalcy, if it ever returns, we will provide those in person as well. But we can also help you with your policies and procedures. If you're saying, you know what, we went back and took a really good look at what our procedures look like within our law enforcement agency when it comes to stalking, and we don't have a stalking policy. So can you help us develop that? That's what we're here for. We're happy to do that. And taking in mind that many of you are experts within your own community, so we can certainly give you some resources and then help you tweak it to what works for best for your community, as well as understanding what are your practices. How are you working with victims of stalking when they come in? How are you making sure that your coordinated community response is inclusive of victims of stalking? Is it focused on the different behaviors and particular risks that happen in those particular crimes? So then also looking at our overall systemic response. So are we doing education both within our communities and within our response systems? How are we investigating these particular crimes to look at the context of the behavior and what's happening? How are we communicating across disciplines? Are we regularly bringing up stalking as part of our response? And if we are, is it limited to just our jurisdiction? What happens if we have our police chief on our CCR, but we didn't include the sheriff's office, and now the offender is engaging in behavior within the sheriff's jurisdiction? How do we coordinate and plan for those particular responses? And how are we prosecuting these particular crimes? What does our prosecution rate look like? How many crimes are even being charged as stalking? And then with those that are charged with stalking, how many offenders are actually being prosecuted with stalking crimes? Because if we're going to go back to that VESPAC model and really look at how are we coordinating across systems, we have to look at all those particular boxes. So now is our time for questions. We don't have a ton of time. For those of you that signed up and thought that this was 90 minutes, this webinar is actually 60 minutes. I wish it could be days and days long, but I imagine all of you are having some fatigue with online training. So no one wants a day-long training. However, we are happy to continue the conversation with each of you individually, but I'd love to take a couple of minutes to be able to answer questions for you as they're coming up for you about the things that we have discussed today. So someone's asking about a certificate for the training. Thank you for asking that. Please do not email Daniel or the TA to TA folks. Please send your email directly to me at this particular address, the director at stalkingawareness.org, to get a certificate for the training. Know that it takes us a little while to process. You know, we don't have a large admin staff, so please let me know if there is anything that we can assist you with as far as that goes. Dana linked the SHARP assessment. Additional questions that those of you have about the coordinated community response in your community? Somebody said that they lost audio. Will the webinar be available? Yes. So we will get the recording from the TA to TA folks and put it up on our website. So the turnaround is usually about a week. So check next week on our website. If you go to trainings and archives, we have all the webinars that we do and record available on our website. So you can listen to it again, you can share with others. Please feel free to download the PDF document here that has the PDF of this particular training. Someone's asking, are all the materials on our webpage free? Yes, everything is free and easy to access, Jackie. So please do so. You can take those materials, you can adapt them. So there's brochures on stalking, et cetera. If you want to put your coordinated community response team logo on them, it's free to do so. That's what we're here for. We know you have other work to do besides creating materials, so please use the materials that we created, and you're more than happy to adapt them. Other questions that are coming up? Are trainings free? Yes. So trainings are free if you are a ODW grantee or potential grantee. So most of you, if you're on this call and you work in any type of response agency, you're a potential grantee. So yes, you can certainly request a training. Like I said, the earliest we're looking at is probably spring 2021 for in-person trainings. We are temporarily grounded right now with the pandemic, but we can certainly do like a video call with all of your CCR, so we could video in and be live with you to answer your particular questions. So please don't hesitate to do that. For those of you that are asking what information do you need for the certificate, just your name is all, and then we put it in for the hour, and then we send it all to all of you. So additional questions? And please send me an email. Don't put it in the chat because I won't get access to that for like a week. So send me an email if you want the certificate. Okay, I don't see any other questions coming up right now. If you do have additional questions, please reach out to us. You go to stalkingawareness.org. Both myself and Dana are linked on there, so you can send us direct emails to ask questions. We are happy to work with you. If you've decided that perhaps your CCR could use some additional training, we are more than happy to work with you on customizing that training. So please reach out to us. And again, with policies and procedures, we're happy to do that as well. So somebody said, is there a community that you feel is kind of ahead of the game on a response to stalking? None that I would like call out without asking their permission. But I would say overall, there's lots of communities that are doing a good response and others that we would want to assist in doing a better response. There's not a particular community that I would hold up as a resource. The New York Mayor's Office has a really great program that focused on stalking, so you can certainly look at some of their resources. But overall, that's something that we're still continuing to build. So if you feel like your community is doing an amazing job, shoot me an email because I would love to know that. So again, thank you all for your time. Thank you for what you do on behalf of victims every single day. Thank you for holding offenders accountable and for giving up an hour of your day to listen to this training. We appreciate what you do so much. And if there's anything that we can do at Spark to help you, please reach out to us and let us know that. So thank you all very much. Have a fantastic afternoon, and we hope to see you on another webinar again shortly. Thank you.